Well, COVID cases are trending downward statewide. Just 3 Northeast Ohio counties remain at the medium level. Those include Erie, Mahoning, and Trumbull. Meanwhile, cases went from 18,000 to 16,000 in the last week, with a 17,000 3-week average. Hospitalizations and ICU admissions both dropped as well. Yesterday, an FDA panel approved the COVID vaccine for the youngest among us, kids 6 months to 5 years. And today, the Ohio Department of Health discussed what parents need to know. So to break it all down, here's senior health correspondent Monica Robbins. Hi, Monica.
Hey, Laura. Yeah, you know, there are 700,000 kids in Ohio under the age of 5 who haven't had access to a vaccine. Yesterday, the FDA gave both Pfizer and Moderna shots the thumbs up. This weekend, it's likely the CDC will sign off. Now, the state has ordered child-sized doses of both, and once approved, they may ship out next week. ODH Director Dr. Bruce Vanderhoff says these vaccines will likely go to providers such as pediatricians, where parents are more comfortable getting their kids vaccinated. And some pharmacies just aren't set up to vaccinate small children. So the advice, talk to your child's doctor if you have any concerns, because the vaccines haven't been shipped yet. Many are not setting up appointments, but that could start very early next week. So check with your pediatrician or health center.
MIS-C, severe COVID, we're not really seeing those conditions in children who are vaccinated, who are eligible. And so I think the whole idea is to prevent what's preventable, because we do see some inevitable tragedies.
So far in Ohio, there have been 79,000 cases of COVID in this young age group, 1,500 hospitalizations, and 10 deaths. They are asking parents to consider the COVID vaccine in addition to making sure the kids get their normal vaccines, because this is important for people to know. The first case of measles was just announced today. This was in Franklin County in the Columbus area. Wow. But yeah, measles is coming out. So these vaccines that are preventable diseases, you know, that's what they're hoping parents will look at the COVID-19 vaccine as the same.
So what do they want parents who are on the fence about the vaccines to know here? Yeah,
there are a lot of parents who may be on the fence. Dr. Vanderhoff pointed out a very good point, though. There is a reason we waited so long for these vaccines to be available for this age group. They wanted as much data as possible to make sure they're safe and the benefit outweighs the risk for the youngest among us. Now, remember, these kids will be getting a 1/10 of an adult dose. Moderna is a 2-shot regimen with 4 weeks between. Pfizer, 3-shot regimen, 3 weeks after the first shot, and then 2 months after the second. And some folks are concerned that because the Pfizer vaccine takes a little longer to get, kids may not be ready in time for school. And these are the types of issues you really need to discuss with your child's pediatrician. But the doctors will say starting any regimen is definitely better than doing nothing.
All right, news you can use. Monica, thanks so much.
Sure.
We appreciate it.